Hey everyone, thank you so much for joining me. My name is Dr. Chris. I'm a prenatal chiropractor at Trailhead Family Chiropractic in Murrieta. This is a super fun topic for me to talk about. One, because I have two kids, and so I've taken care of my wife throughout the course of her two pregnancies, and so I know the benefits firsthand. But two, I'm a diplomat in pediatric and prenatal chiropractic certified by the ICPA. So this is a subject that I studied a lot on, and I'm really excited to bring all that expertise of years of study and condense it in just a short webinar for you. This is going to be packed with information on things that you might have heard about, that you might not heard about. So be sure that you share this information with anyone you know that also is pregnant. A quick outline, we're going to go over kind of why having a pediatric chiropractor on your team during your pregnancy and postpartum experience is going to be helpful. We're going to go over a little bit of anatomy in the spine, in the pelvis, so that way you can understand maybe if you experience some difficulties or aches or pains, why you might be having that. We're also going to jump into a little bit of neurology, so that way you can understand the whole picture and how it all comes together to help you have the optimal birth that you are envisioning. Whether it's in a hospital, a birth center, or a home birth, a prenatal chiropractor should be on your team no matter where you plan on birthing your baby. So who is on your birth team? That's the first thing that we're going to talk about. A lot of the times people employ a doula. If you don't know what a doula is, it's essentially someone that's there to be an advocate for you. Whether you're in the hospital or at home, they can talk you through, they can help relax you, give you basically an idea of what's happening so that you can make the best decision for you and for your baby. They oftentimes will do birth classes as well, so that you're able to understand what exactly is going on. A second, more medical person that you're going to have on your team is a midwife or an OBGYN. Those are the people that are obviously managing your care throughout the course of your pregnancy, making sure you and the baby are healthy. And it's also going to be the one that will typically help deliver your baby as well. Most of the time, what's left out of your birth team, though, is a prenatal and pediatric chiropractor. Unfortunately, we get left out mainly because there's not the awareness. Most midwives will refer to a pediatric chiropractor or a pediatric and prenatal chiropractor, which is awesome. Awareness is still not there on the medical side and the OBGYN side. And so if you do have an OBGYN that you think might be interested in this information, please share that with them. I'd love to connect or have coffee, or really just make sure that we get this information out there, because once people hear it, it just makes sense. So having a prenatal chiropractor on your team is super, super important, because we help not just make sure everyone is alive, like a more of a medical approach, but we make sure everyone is thriving, everyone is growing the way they should be, and that you're out of pain and that you're as comfortable as you can be throughout this whole experience. We're going to jump into some neurology right away because this is one of my most favorite things to talk about, and I talk about with every single one of my patients on their first visit. Your nervous system is the way you are able to interpret and adapt and communicate with the outside world. So it's really, really important that we make sure your nervous system is working well. I'm going to break it down one step further. Within the way your nervous system works, it'll either activate into a state of stress, or it'll activate into a state of growth or relaxation or development. We want to make sure that this system is balanced, because it's like a yin and a yang. When one is on, the other is off. And so if we can keep the mom in a state of relaxation, growth, and development throughout the majority of her pregnancy, that's going to be really, really good insurance that everything is developing the way that it can be. So within your nervous system, you have two basic behaviors. You have two different basic states. You have a state of stress or survival, and you have a state of relaxation, growth, and development. Now, if you're pregnant and you're thinking, man, I definitely want to make sure that I'm staying in that parasympathetic or relaxation, growth, and neurodevelopment stage, you're definitely right. Unfortunately, through most people's pregnancies, especially before they come see me, they are in a state of stress, mainly because they're working high stress jobs, they have 2 or 3 other kids at home, or there's something going on that's causing the neurology to default into a state of stress. And that's really what we're going to get into here in a minute. I like to use the analogy of a gas pedal and a brake pedal. Mainly because it just makes sense. It helps it explain, takes it from a hardcore neurological concept to something that we use every day, to a gas and a brake pedal. Okay, your gas pedal is, we say, you're in a state of stress or survival or fight or flight. Your brake pedal is more when you're in a state of relaxation, you're in growth, and you're in neurodevelopment mode. Okay, now if a car was stuck all the time on gas pedal, you can see the ramifications. You can't take sharp turns, you can't adapt well to what's going on to where you need to drive that car. Versus if you're going a little bit slower, if you have quicker access to that brake pedal, you're able to take that car wherever you want it to go safely. The same thing goes on within the body. If the body's in a constant state of stress, you're not going to be able to adapt well to what's going on in your environment. I'm gonna grab my spine model so that way I can explain this in a way that makes it a little bit easier to understand. This is the spine here. So when you see a chiropractor, this is mainly what we're gonna be focusing on. We're making sure all the joints in the spine are moving the way they're supposed to, okay? You can see these little yellow things. Those are nerves carrying information from the outside environment to the spinal cord, which is your communication highway. That takes that information to the brain, which is a sensory processing computer, the main hub of it all. The brain is going to figure out, put the whole picture together first of all, and figure out what to do with this information. Once it figures that out, it's going to send a message back down through the information highway, through the spinal cord, and then out the appropriate nerve to the appropriate body part so that you can continue to adapt and survive and thrive in this world. So we're in a constant communication loop. The only thing that can go wrong is if we have interference or a disconnect within this communication loop. And that's what happens when your joints stop moving the way it's supposed to. That relay system gets disrupted or interfered with or distorted, which changes the information reaching the brain. When the brain is receiving incomplete, delayed, or distorted information from the body, it's going to default into a state of stress. And it does that because it wants to make sure that it's not vulnerable to injury. So if your spine is not moving the way it's supposed to in 1, 2, or even 3 areas, that can be causing this constant trigger of your body in a state of stress, which could look like poor sleep, tight muscles, tight ligaments, poor digestive system, overall general feeling of anxiety. That's how you know your body is stuck in a state of stress. And what we want to do is bring it over to the opposite side. And that kind of introduces the main technique that we use within pregnancy called the Webster Technique. It was developed by Larry Webster, back in the day. It's a technique that's been used for a long time. For those of you that have had a baby go breech or transverse or sunny side up, especially close to when your due date is, most likely you've run across the Webster Technique because it's famous for helping the baby get into an optimal position for birth. And in fact, we don't even do anything with the baby. It's not a turning technique or anything like that. I don't even palpate for where the baby is. I'm not even touching the uterus, really. What we do is we help the mom get into a state of relaxation by using the bones and the ligaments and the muscles and knowing the effect that chiropractic has on the nervous system. So let's get into this real quick. Number one, we have the bones. So that's obviously the bones of your low back. We have the bones of the pelvis, and we also have the sacral bones, okay? We already talked about if your joints in your spine aren't moving the way they're supposed to, that's gonna affect communication between the brain and the body in that specific area. Well, the nerves that are coming out from your low back are actually going to the mom's uterus. So if your brain isn't able to tell the uterus when to contract or how hard to contract, that's obviously going to change your labor and delivery experience. It's going to either make it longer, or maybe you have to go into, a lot of ladies go in, one stage at a time. And if things go too long, the OBs are definitely going to want to do a C-section. So making sure that your low back is moving the way it's supposed to is giving you just the best chance to contract when it's supposed to, how hard it's supposed to, and in rhythm when it's supposed to, so that you can have your optimal labor and delivery that you want. The next one that I want to talk about is the sacrum. The sacrum forms the back wall of the birth canal. Okay, so it's really, really important that we have the sacrum adaptable, able to move to where it's supposed to so that the baby can wiggle through the birth canal. If we do have a sacrum that's stuck or leaning towards one side or the other, that can distort the shape of the birth canal. It can also distort the width of the birth canal. And when the time for the baby is near, we want to make sure that sacrum can do whatever it needs to get the baby out as smoothly as possible. And the last thing, when the bones aren't moving well, the sacrum isn't moving well, that's gonna start to affect the ligaments and the muscles. One of them that you see on your slide there is the round ligament. The second one that you see is the uterosacral ligaments, okay? If the sacrum isn't moving right, if it's tilted towards one side or the other, that's gonna pull on the uterus, which in fact is gonna pull on the front side on the round ligament. So if you've ever had like that sharp round ligament pain on one side or the other, it could be because your sacrum isn't moving right. And so what we do is we align the low back, we align the sacrum, make sure everything's moving the way it's supposed to, and then we also address what's going on with the round ligaments. It's a super special ligament. There's no other one like it where it actually has smooth muscle that surrounds it, so it can contract and cramp. And so there's a technique, the Webster technique, that we use to not only align the sacrum and the low back, but also to help get those ligaments and muscles moving and feeling and stretching and contracting the way that they are supposed to. So you might be wondering, is pediatric and prenatal chiropractic safe? The blanket answer is yes, it's completely safe, especially for somebody that has taken way more training in the pediatric and prenatal population. Adjustments are very, very gentle. We do adjustments in multiple different ways, from a drop table adjustment to a manual diversified type of adjustment. Every single person that I adjust, you can just see the look go from like stress to relaxation because of how much tension we take off the muscles, how much tension we take off the ligaments, and because we're helping the mom enter into that state of growth, repair, and relaxation. The last benefit, obviously when we talk about chiropractic, is gentle and safe. It helps relax the nervous system, and it also promotes proper pelvic alignment, which we went in depth with just a couple minutes ago when we were talking about the Webster Technique. So you might be wondering what it might be like to come get adjusted at a chiropractor. What's their first appointment like? We here are very at Trailhead are very objective and personal with our chiropractic care. When you come in, you'll already have your paperwork filled out, so that way we can streamline the appointment. Kids, babies are welcome at your appointment. We have a wonderful waiting room with Legos and chalk that the kids can be entertained with. Our exam and initial appointment is really unique. It's what actually sets Trailhead apart from many other offices, especially in this area, where we do an infrared thermography scan. And what that measures is inflammation from your low back all the way to your neck. There's no radiation or chemicals or anything going into your body. It's just reading body signals. And what I get when I do an infrared thermography scan is I get which joints are inflamed, meaning which joints aren't moving the way they're supposed to. So that way I can apply the adjustment to that specific area. It also lets me know how bad the problem is. So that way I can let you know, this is how many adjustments I think you need throughout the course of your prenatal experience, so that we can continue to maintain proper adaptability and maintain your body in that state of growth and relaxation. We also do something called a surface EMG scan, which measures muscle tone. When your body is in a state of stress, your muscles are going to be tighter, and specifically where those joints are locked up, it's the muscles that are actually keeping the joints from moving. And so by doing that surface EMG scan, it's a second level of certainty to see where exactly the root cause of your problem is and how bad it is. And that gives us, once again, a gauge and a plan to let you know, this is how many times we need to see you throughout the course of your chiropractic care. And then also, lastly, we'll do a posture assessment. So that way we can make sure their shoulders aren't hunched forward, your head isn't tilted one way or the other, your hips aren't tilted one way or the other, so that we can make sure that your body is ready to adapt for labor, for delivery, and also for that postpartum experience, because we know there's a lot of changes that go on through each trimester throughout pregnancy. And so making sure that we're rescanning throughout the course of care is also a big benefit to you, to make sure that not just are you feeling well, but objectively we're able to make sure that those tests are letting us know that you don't have any stress in your system and that your body is optimally ready for labor and delivery. And then the really cool thing is that after you give birth, after you have that optimal birth experience, we also have information for how your body was in your prenatal experience, so we can scan you again and address any problems that arise during your postpartum experience, because the posture problems don't go away once you have your baby. In fact, sometimes they even get worse. The problems go from mainly being focused on your low back to mainly being focused on your upper back and neck because of breastfeeding, because of holding the baby. And so that gives us really good information on what to do in your postpartum experience to help you have that optimal recovery that you want. One last thing that I wanted to go over is just a couple testimonials. There's one mom that she was going through her pregnancy expecting to have a hospital birth. When she was in labor, she decided right there, I'm having a home birth. So we called a couple midwives, got everyone over there medically that we needed to get. Labor was going really well. Contractions were coming, then all of a sudden things just kind of stopped. Her doula is one of my good friends. She gave me a call, and I actually did a home visit for them, which I do for a lot of my patients if we've established care before that, so that they can have that home birth experience. I used the Webster Technique, and actually within an hour or two later, labor started up again, really intense. And then I got another call, it was about 9 o'clock at night, saying, hey, we need you again, things have slowed down. And I came over and we did the adjustment again, and then a couple hours after that, baby actually ended up coming. And so we are all convinced that if a prenatal chiropractor wasn't a part of her birth team, either labor would have been much longer, increasing the chances of injury, or she would have had been transferred to the hospital to get on Pitocin or things like that. Another testimonial that I like to talk about is a mom that had a breech baby from pretty much like 25 weeks all the way up until, what the doctors were talking about, we need to plan a C-section and things like that. She came in to me pretty much desperate, had tried all the spinning babies, had tried all the exercises to try to get baby to turn, and baby was just not budging. We did her scan and realized that her body was in a state of stress. She had lots of high muscle tone, lots of areas of inflammation. Her posture was pretty bad. And so I said, this this is what we're going to do through chiropractic care. We're going to do the adjustment. We're going to allow your body to enter into a state of relaxation, growth, and development. And the baby is going to feel the same way. And that's what's going to allow the baby to see, okay, now it's time for me to go. Mom's ready, alignment's there, there's a lot of space for me to move. So we did the adjustment, and I got a text or a phone call a couple days later saying that the baby had turned on its own, which is a super, super awesome experience for the mom, now avoiding surgery, now avoiding going into the hospital, and able to have, that birth that she wanted. And then the last testimonial is a VBAC birth. So if you don't know what a VBAC birth is, it means that a mom went through a cesarean section with her first, and then for the second wants to have a vaginal birth. So it's vaginal birth after cesarean. A lot of the times they put these moms in a high risk category. So if you're going for a VBAC, I definitely recommend that you have a pediatric and prenatal chiropractor on your team, because I believe that it gives you the best chance possible to have the birth that you want, because the more stress that you're in, the less of a chance your birth is going to go the way that you want it. The less stress you're in, the more your body is able to deliver and going through that labor process the way it was designed to. And so she was with me pretty much from the beginning all the way through the end of her prenatal or her pregnancy experience. She was able to have that VBAC successfully, where she didn't have to have another C-section. And she was just super, super thankful, because the more C-sections that you have, usually the less babies that you can have because of scar tissue and entering into a higher state of risk. And so it's really, really important to make sure that she was able to have the birth that she wants so that she could have future babies as well. I hope this was super, super informative for you. If you're interested in learning more, our number is 951-698-4848. You can call or text us at any time. You can follow us on Trailhead Family Chiropractic on Facebook or Trailhead Chiro on Instagram and send us a message. We do have special offers for you available when you watch this webinar. So if you do call or text us, say, hey, this is my name. I watched Dr. Chris's webinar on the benefits of chiropractic care. He mentioned a special offer in there, and then we'll go ahead and give that to you. So that way we can lower the burden of entry to make sure that we do everything possible to encourage you to come in and get your body checked during your prenatal experience. It's never too early. You can be 6 weeks. It's never too late. You can be 41 weeks. I had a lady come in for her first visit while she was in labor. And like I said, I went and saw that mom that was in labor at her home. So it's never too early. It's never too late. The more adjustments, the more supervision that we can get from a chiropractor throughout your labor and delivery, the better. But it's never too late or never too early. If you have any questions, feel free to email me, text me. I'd be happy to answer any questions that you may have. Thank you so much for tuning in.